Hi, I'm Rich Lucas from HFMA. Welcome to HFMA's annual conference here in Las Vegas. Today we're welcoming LGI's Stephen Brogdon, Sales Director, and Dr. Saad Syed, Business Solution Advisor. Welcome, gentlemen.
Thanks.
Hi, Rich.
So, Stephen, first question is for you. What are the unique benefits of LGI's RPA brings to healthcare clients, particularly in revenue cycle management?
Yeah. So, Rich, at LGI, we operate with a specific focus in healthcare. So healthcare is the only industry we serve. This approach has enabled us to gain a high level of familiarity with the needs of our clients and then tailor our technology and solutions offerings accordingly in order to increase the operational efficiencies for our clients and improve their key performance indicators. Specific to revenue cycle, we've worked with our clients over our 35 years in business to complete hundreds of revenue cycle projects in all areas, from front end to mid cycle to back end, covering all EHRs, any website, any payer portal, always with the goal, Rich, of taking a labor intensive process and offloading it to machine driven automation in order to help our clients increase their operational efficiencies cost effectively. And in terms of awards, we consistently score straight A's with the class organization, and last year the Black Book organization interviewed roughly 5,000 finance executives in healthcare, and we're proud to say we ranked #1 for revenue cycle optimization.
That's fantastic. Congratulations. Yeah, wonderful stuff. Yes. Dr. Syed, what types of revenue cycle projects does LGI support for its healthcare clients?
Yep. I would say over the years, we've worked with all of our clients to identify and deliver all kinds of revenue cycle use cases. To give you some examples, it would include claim status denials, prior authorizations, physician credentialing, 835 posting, just to name a few. These include short-term automations that would be catch-up, clean-up kind of work, where a lot of labor-intensive work kind of takes away time of the staff that they could not complete those tasks in time. So we help our clients to make those automations help with quick turnaround times. Apart from that, what we concentrate more on is more of long-term automations, wherein we work on types of processes where we incorporate EHR managed services that helps with operational benefits to the clients. This also gives us opportunity to automate processes end to end, right? This has helped them save effort from the revenue cycle staff point of view, so that they could concentrate more on things that are more complex and high value to them.
Fantastic. So they can concentrate on those complex areas.
Yes.
Fantastic. Steve, next question is for you. How does LGI's RPA professional service differ from your competitors?
Yeah. So at LGI, Rich, we have a unique offering in that we have an in-house professional services team that offers deep expertise in revenue cycle management. So our clients can choose to work with our team to, first of all, identify opportunities for automation and revenue cycle, and then at no charge, our team will review their workflows and deliver to them a detailed scope of work for converting those workflows into machine-driven automation. So in an engagement with our team, we can cover everything from identifying opportunities for automation to solution design and development, and then get into rigorous testing, and then finally production deployment. And then afterwards, if the client wants to, they can engage our managed services offering to have us take care of their automations on an ongoing basis to ensure optimized performance and minimize downtime. And then finally, Rich, we do have a formal training program for any of our clients that want to learn the LGI RPA platform and become autonomous in building and managing their own automations. We can get them there through a formal training program.
Fantastic. So really end to end.
It is.
That's fantastic. Okay. Next question is for you, Doctor. Can you explain for us the difference between artificial intelligence, robotic process automation in healthcare industry, and provide examples of RPA being applied to improve patient care, operational efficiency?
Yeah, sure. I think in healthcare industry, AI and RPA serve different, but at the same time complement each other, right?
Okay.
So if you look at AI, they are more of advanced analytics and predictive analytics to check on patient outcomes or read medical imaging and interpret that. While on the other side, RPA, what it does is it automates repetitive administrative tasks to kind of improve the efficiency and operations for the client, right? So how I think of this is RPA acts as a base for AI to work together.
So, gentlemen, this is really all the time we have. Thank you for the time, and again, thank you for your support of HFMA.
Thank you, Rich.
Thanks.
All right, thank you.